My name is Melissa Seifert. I am the Associate State Director for Government Affairs for ARP Michigan, and I am honored to be here tonight to serve as your moderator. So again, I want to thank everyone for joining us today for this very important discussion on forming a Prescription Drug Affordability Board, which we all like to call PDAB. So if you hear PDAB from now on, know that that means Prescription Drug Affordability Board. I want to mention we are recording this and broadcasting it live on Representative McKinney's Facebook page, so I also want to thank those who are joining us online. We'll take questions from the public here in person after our speakers make their remarks. The lawmakers staff have note cards and pens for you to write down your questions. So when you do want to ask a question, please raise your hand. We'll pass out note cards. Just write your questions down. We'll grab them and ask them to the panel. One note on those note cards is to please include some contact information if you do want to be contacted afterwards, whether it's your name for sure, please, and then your email address or phone number. So with that, I want to introduce our amazing panel for today to talk about the Prescription Drug Affordability Board, or PDAB. State Representative Donavan Mckinney, currently serving his first term, serving House District 14. Yes, quite popular, my friend. State Representative and Majority Floor Leader Abraham Ayash, currently serving his second term, serving House District 9. State Representative Mike Mcfall, currently serving his first term, serving House District 8. And then Dr. Rob Davidson, a West Michigan emergency physician and Executive Director of the Committee to Protect Healthcare. So with that, I will turn it over to your all-time favorite, Representative McKinney.
Thank you, Melissa. Thank you all for being here today. I like to always start off by saying you can be anywhere else in the world, but you're here with us. So again, thank you for your time, thank you for your presence. I want to thank Majority Floor Leader Abraham Ayash, State Rep Mike Mcfall, as well as Dr. Davidson and Melissa for being here as well. For those who do know, probably everybody knows me in the room. Those who watching online, maybe not. My name is Donavan Mckinney. I'm the state rep in Michigan's 14th House District. That includes primarily DeQuinder to the west, Hoover to the east, Davidson to the south, 13 Mile to the north. So parts of Warren, all of Centerline, Northeast Detroit. Welcome to the 14th House District, where we're located right now at Farwell Rec Center. We are here today to discuss pretty much a crucial piece of legislation that will create a Prescription Drug Affordability Board right here in Michigan to help lower the cost of prescription drugs that so many are unable to afford. How many people heard the State of the Union address by President Biden earlier this year? He's done his due diligence with the Congress to try to put a cap on insulin, right? And so we want to try to do the same thing here in our state for prescription drugs across the board. For many Detroiters, the skyrocketing prescription drugs costs force residents to make those tough decisions. I've heard from constituents time and time again that they have to choose between paying their utility bill or, getting their, life-saving drugs, or getting some gas or groceries, or getting their prescriptions, or sometimes having to even cut their prescriptions, little pills into pieces to try to survive day to day. And we're tired of it, right? Enough is enough, am I right?
Right.
And so this has been going on for far too long, and we want to try to rein in those prices that are skyrocketing as we speak, and it's because of corporations and big pharma who are reining in major profits that we need to put some, caps and hone on what's going on. So with that being said, I do have to say this: a PDAB, for those who don't know, is an independent public body that meets and researches the affordability of prescription drugs and caps their costs, so Michigan residents can afford the medications they need to survive. This is something that the governor, Gretchen Whitmer, supports and called on the legislature to pass last fall. And also last October, the Senate passed the bills, and now it's our turn right here in the House. And so I'm happy to have two of my colleagues here to really discuss the true need for PDAB. Looking forward to getting to work on this legislation and to seeing it pass soon. Again, thank you for coming today, and I look forward to answering your questions. And now I'm going to turn it over for introductory remarks to our majority floor leader, second in charge in the Michigan House, state representative out of the great city of Hamtramck. He also represents parts of the east side as well of Detroit, Abraham Ayash. I gotta say, this is a very powerful man. If you need any money, talk to him.
I gotta talk to myself then. Good afternoon, good evening, everybody. Abraham Ayash, State Representative and Majority Floor Leader in the Michigan House. So, Rep. McKinney, Donavan highlighted the role of a Prescription Drug Affordability Board that would allow us in the state of Michigan to convene a public body, to have the conversation and in the public, in the open, and actually discuss and deliberate the concerns for so many people, which is the cost of prescription drugs, the rising cost of prescription drugs. I'm gonna give you guys some facts. Number one, stocks and dividends of pharmaceutical companies have gone up in the last 20 years, and their investment in research and development has gone down. So they're making more money, but they're spending less of that money to actually research, to improve on the sciences of so many important medications in this country. So they're not hurting. In fact, they're eating far better than you are with the pizza tonight. So,
I don't know about that. It's good pizza.
shout out to Jets and Detroit style. But if you think about what we saw during the pandemic, right? You had a federal government that invested in the research and development of the COVID vaccine that has saved millions of lives, billions of people across the globe, millions in the United States. And then all of a sudden, you saw these big companies, Pfizer and Moderna and Johnson & Johnson. They promised they were not going to increase the price and make it more difficult, but as soon as most of us got our vaccines, you saw an uptick in the cost of those medications. Now, one has to wonder, why did that happen? It's because we don't have the regulatory watchdogs to rein in these pharmaceutical companies. So in the state of Michigan, the Senate Democrats rolled out legislation that's incredibly important, that's building on the success that we've seen in Washington, D.C. So we commend the congressional Democrats. We've got to be very clear on who did this. It was Democrats in Congress, Democrats in the White House that capped insulin costs to $35 a month. And earlier this term for the president, they recently announced 10 drugs that are going to be negotiated directly with the pharmaceutical companies that Medicare can, for the first time ever, negotiate for the prices to reduce costs for our seniors all across this country. This is life-saving medication. It's medication that prevents blood clots, that addresses diabetes, medication that deals with high blood pressure and heart disease and arthritis, all things that can, if treated, improve the quality of life of so many of our seniors across this country. So, I want to close with this point. The pharmaceutical companies, is it okay if I swear in here? Just a little bit. The pharmaceutical companies are scared as hell of the Prescription Drug Affordability Board, the PDABs. They are spending millions of dollars in advertising. They are spending hundreds of thousands of dollars in Lansing, our state capital right now, to jam up this legislation. Because they know if we begin to look at the prices of drugs and have that conversation publicly, they don't have an argument to make. You can't tell me that you can charge someone thousands and thousands of dollars for a drug that you are making 10, 15, 20, 30 times the amount of what it actually costs to manufacture and research and develop. So they are going to spend a whole lot of money selling you with fancy ads and commercials and billboards and mailers and whatnot. Y'all got to not fall for the okie doke. Okay? This is the east side, right?
That's right.
We don't fall for the okie doke in the east side. The west side, I got another story for them.
He said, don't do that.
I love all of Detroit. But this is why it's incredibly important for us to stay alert and recognize why this PDAB is so important. So you're going to learn about the PDAB today, and you're going to go home and tell your friends and family why this is so important, and you call your state representatives and say, get it done. It's time for us to move it on the floor to finally vote to get the Prescription Drug Affordability Board signed into law. So I look forward to the conversations we're going to have today, and I'd like to turn it over to my colleague out of Hazel Park, who has been an incredible legislator in the 15 or so months that he's been serving. And I got to tell you, Mike gets it. I can't say that about everybody in Lansing, but Mike gets it. And he's willing to stand up and say the right thing, and more importantly, he's willing to do the right thing, even when the pressures are against him. So everybody give it up for State Representative Mike Mcfall.
Very, very kind of you. Thank you. I appreciate that. Hi, I'm State Representative Mike Mcfall, and I'm really short, so this thing's like right in my face. But I appreciate everybody coming out. This is a very important topic. I hear from people in my district all the time regarding their medications and the expense and the choices that they have to make. You know, you shouldn't have to make choices between paying a bill like your heating bill and your electric bill and paying meds. So what this will do is it'll be a public board, and it'll shine light on the decision-making process of where they get their pricing from. You know, and so this board will analyze what the pricing is, how they set their pricing, but this will come out of the darkness because it's usually done in private. We have no idea where they come up with how they raise it. I'm sure you've all seen in the news where suddenly something that was $35 is now $1,500, which, how does that happen? Yeah. You know, especially if it's something that isn't exactly brand new. So I'm not going to take up a lot of your time because both of my colleagues have spoke quite a bit about where we're headed with this meeting as to why we're having this town hall. So I will hand it over to Dr. Rob Davidson. Sorry, they gave me a script and I'm trying to follow it as close as I can. I'm not very good at following a script. Dr. Rob Davidson, I appreciate you coming. Please put your hands together for Dr. Rob.
Thanks. Appreciate it. And I got to say, so I'm here, I'm an emergency physician here in Michigan. I actually work out on the west side of Michigan, but I grew up about 9 miles north of here. So I'm from the area, and I'm also the executive director of the Committee to Protect Healthcare. So all of these great organizations up here, we are also up here. We're supporting this legislation that got through the Senate. And I'm really excited to be here with three amazing reps from the east side over here. Because as physicians, I mean, we talk about this with our patients all the time. I think you all probably talk with your doctors all the time when you can't afford things, and how do I get something cheaper? How do you get a workaround? How can you get me a coupon? And we have a system that depends upon coupons to get something that can save your life. We are in trouble, and I love that we have people up here that get it, that went to Lansing to actually help people and hear from people, and then want to bring that and bring someone like me in here and work with a coalition like this to get this passed. Through my career, I have seen firsthand how high drug costs hurt my patients, especially vulnerable children and seniors in our state. Really, doctors will tell you across the board, no matter their political affiliation or who they vote for, how devastating and infuriating it is when our patients know what they need, we prescribe what they need, but they can't afford the medications that we prescribe. The Michigan Prescription Drug Task Force, to give you a few numbers, found nearly a third of residents aged 19 to 64 stopped taking their prescriptions because of the cost. Another survey found over a quarter of Michigan adults reported they cut pills in half, like Rep. Mckinney had said. They skipped doses of medications or just didn't even fill the prescription in the prior 12 months due to cost. This crisis is endangering people's lives by putting fragile lives at risk just because of big pharma's greed, like you've already been told here. I can tell you patient stories. I can come up with them from last weekend when I worked. The number of people I've seen with diabetes who come in because they've been drawing a little less out of that vial and giving themselves a little less of their insulin every night, and then they come in after 2-3 days and they're getting sicker and sicker. They can't eat, they can't drink, they go into ketoacidosis. Their body is basically shutting down, and it didn't have to happen. It only happened because they're rationing that drug that is vital to their livelihood. I saw an individual just the other day in their late 30s who'd been diagnosed with an autoimmune disease that attacks their own intestines. They need an infusion every month, and they hadn't had it in over a year because they didn't have their insurance and they couldn't afford that life-saving medication, so they end up in the ER getting doses of steroids that can help kind of get them a bridge to the next day, but meanwhile that disease is wreaking havoc on their bodies. Doctors across the state and I are so grateful that we have a governor who actually champions this legislation. She called for the legislature to pass a PDAB last summer when she addressed the legislature as we're getting back into Lansing. The Senate did it, the House needs to do it. This is not a new thing. This isn't some unknown and we don't know how it works. This legislation is modeled after laws that are present in 6 states that have already established PDABs, and we have several others, including Illinois, and I'm actually going to be talking to some folks in Illinois tomorrow about it, that are in the process of creating their own independent boards right now. We would have experts in the field of healthcare economics, health policy, and clinical medicine, and they would not be allowed to have any financial stake in the pharmaceutical industry. There'd be strict rules preventing politicians, so they're going to form the board, but they're not going to get their hands in on the board. This is not a government program. This is just setting up a board that can help shine the light on the cost and bring down those costs. We're going to keep the healthcare industry and special interest groups out of this process. They can't influence the board's decision. We need an advocate for Michigan consumers and my patients here in the state, and that's exactly what a PDAB would be. Thank you all so much. Look forward to answering.